The Objective Structured Clinical Examination, OSCE, is a vital part of the Nursing and Midwifery Council (NMC) registration process for international nurses aiming to work in the UK. It assesses practical nursing skills through a series of stations that replicate real-life clinical scenarios. Now let's talk about its eligibility and requirements. To be eligible for the OSCE, candidates must do the following. 1. Pass the computer-based test, CBT. See our CBT bank of practice questions on our Health Workers Bio website. 2. Once you pass your CBT, your portal will be updated to reflect pending OSCE exam. The OSCE is mandatory for non-EEA nurses and those re-entering the register after a break. Now to the OSCE exam structure. In the past, the OSCE has 6 stations, but now the OSCE consists of 10 stations, divided into the following. 1. APIE stations. 4. Assessment, planning, implementation, evaluation. Clinical skills stations. You will be tasked with 4 practical nursing skills of varying choices: IV flushing, catheterization, etc. 3. You will be tasked with 2 professional behavior stations: communication, professionalism, and evidence-based practice. These stations reflect real-life clinical scenarios that nurses may encounter. Let's talk about NMC's exam centers and fees. The OSCE is conducted at the following approved centers: Oxford Brookes University, University of Northampton, Ulster University, Northumbria University, Leeds Teaching Hospitals, NHS Trust. The exam fee is £794. If retaking, the fee is £397 for up to 7 stations and £794 for 8 or more stations. Passing the OSCE is essential for practicing as a nurse in the UK. If a candidate fails, they can retake the exam with detailed feedback provided for improvement. To ace your OSCE, you need the following steps. 1. Know everything about OSCE. Check NMC UK website and read up the guidelines and overview first. 2. Tag along with a UK registered colleague or another nurse preparing for OSCE to allow for information sharing and practice. 3. Depending on where you would love to take your exam, assessment checklist can be found on the exam center's website. Download the material to prepare for mock exams and workshops. Simulate the OSCE environment. 4. Again, online courses and study groups. Engage with peers and online resources. Check our website healthworkersbio.com to connect. Key focus areas include communication, clinical skills, ethical practice, and patient care. 5. Prioritize communication skills. Clear and compassionate communication is essential. 6. Understand each scenario. Read and interpret each station's requirements thoroughly. In conclusion, the OSCE is a critical step for international nurses aspiring to join the UK nursing workforce. Thorough preparation and a clear understanding of the exam structure are key to success. For more detailed information and resources, visit the NMC OSCE webpage.